Hi, my name is Bertha Rivera. I'm a registered nurse and I'm doing a presentation on workplace violence. It seems that workplace violence has become an epidemic in the United States that even OSHA, who is the Occupational Safety and Health Administration, has reported that 2 million American workers have become victims of workplace violence annually. The Emergency Nurses Association also states that 86% of 1,000 members have reported some kind of violence in the past 3 years. Some of the data from the Bureau of Labor Statistics shows that 21% of nurses and nursing students have reported some kind of physical abuse, while up to 50% have reported some kind of verbal abuse. Data also shows that 80% of the incidents were caused by patients. Data also shows that healthcare settings are 4 times more likely to get some kind of violence versus other private sectors. What is workplace violence? Well, it is defined as a violent act including physical assaults and threats directed towards persons while at work, according to OSHA. There are 2 types, verbal abuse and physical abuse. The University of Iowa Prevention and Injury Center has come up with a 4-point model, breaking it down into 4 types. The type most common in hospital settings with healthcare is type 2, which is the violence committed by clients or customers. Well, what are the risk factors in work settings? Well, some of those would be working with people who have had a history of violence, working with people who have been under the influence of drugs, working alone, the presence of firearms, maybe there is not adequate security staff, maybe there is unlimited public access, and one of the biggest things is perception that it has to be tolerated. Some of these perpetrator risk factors would be those who have mental disorders. 87% has been reported to be from patients with dementia. Again, the influence of drugs is a major issue, the inability to deal with any kind of crisis situation. And it also has to do with gender and age, according to statistics, most of them being men between the ages of 35 to 65 years old, and of course, having the availability of some kind of weapon. What workers and what sites are at greater risk? Well, you would have the psychiatric aide, the nursing assistant, the nurses, physicians, and it is also pointed out that gender and age have a lot to do with it. Usually women under the age of 40 who are single and who have worked longer hours, who have less experience, and who do not have any training to workplace violence. Some of these sites you might find this personnel would be in the emergency rooms, being the biggest one of them all, psychiatric units, ICUs, the pediatrics and neonatal units, and long-term care facilities, mainly because they have a lot of dementia population there. Possible causes that have increased violence in the workplace have been the closure of several mental health hospitals, reduction of funding for addiction programs, patients who have been exhibiting drug-seeking behavior, overcrowding, shortages of nursing, and misconceptions that we as staff do not care for the patient, and the lack of a visitor policy. The cost of violence does just not come in monetary terms. It is also costing a lot for medical treatment of the employee who is missing work, the satisfaction of work from the employee, and in turn is causing loss of satisfaction from the clients. Barriers to reporting are fear for retaliation, the lack of physical injury, the inconvenience of reporting, thinking that customer service is going to be down if you report. The biggest misconception, of course, is violence should be accepted in the job. The lack of proper policy to report, the lack of support from the administration, and being viewed as incompetent or weak if you report. Some solutions to deter violence in the workplace would be to implement the OSHA guidelines, which are to prevent workplace violence for healthcare and social service workers. Be aware of the problem. Make sure that there is a zero tolerance policy that even patients and visitors are aware of. Make sure that there is some kind of prevention program that would allow for proper reporting, to make sure that there is a strategy if there is an incident in the facility, to make sure that there is management if there is a situation that happens, and to make sure that you are always supportive of your employees. In addition, having an employee ID system will help, making sure access is restricted to personnel. Make sure that there is safety and health training, maybe improving the facility design as far as making sure that there is an area for those who have behavioral health problems, maybe building a psychiatric critical care unit, and making sure again that education is available for all staff, including patients. Additional protective strategies can include self-defense classes, personal protection, personal cell phone that they can use in case that they are stuck by themselves in a situation, Again, reminding them that there is a zero tolerance policy in effect, and making sure that support is available to the employee who went through the crisis, and to make sure that at times, if you are working after hours away from the facility, that somebody knows where you will be at, and making sure that there is no house calls after hours in certain neighborhoods. The American Nurses Association has adopted a Bill of Rights for nurses, stating that they have a right to work in a safe environment. The National Institute of Safety and Health, along with OSHA, also mandated that healthcare organizations make sure that there is a safe environment for people to work in. JCAHO states that facilities also need to make sure that they adopt policies that state that assault will no longer be accepted in any kind of workplace. The Emergency Nurses Association has also led to advocate for criminal penalties regarding violence in the workplace. So as far as leadership goes, who is the best person to help in that crisis, in that situation at that moment? Well, it could be a leader that is authoritative. It could be a leader that is democratic, or it could be a leader that sits back and sees what happens. Well, regardless, the best characteristic would be a leader that holds emotional intelligence. Why? Because they are able to perceive, understand, and to control their own emotions while being able to help others and see what kind of emotions the other has. Some of those components of emotional intelligence are being self-aware, regulating self, making sure that they motivate others. They understand, they have empathy with the perpetrator along with the victim of the situation, and they also have social skills to talk down a possible perpetrator that may be ready to cause violence in the workplace. Some of those roles are that they are able to resolve the conflict. They can address the conflict and make sure that they confront the person without feeling them threatened. They can come up with alternatives to making sure the conflict does not escalate, and they can recognize and accept the individual's feelings as to why they feel that they are acting up, and lessen the situation. They have good communication skills, and they are able to negotiate with that person that could be causing any harm, not just to one staff member, but it could be the population within sight. It is the responsibility of all to make sure that we are aware of workplace violence and to report and to act. And we as nurses need to make sure that we refuse to accept the status quo that workplace violence is part of the job. It is not part of the job, and we need to advocate for better policies within our workplace and make sure that we are feeling safe, not only for ourselves, but for our clients, our coworkers, anybody else who'd be a visitor in the facility, and make sure that we are aware of what we can do. Thank you for listening, and have a great day.